Hello and good afternoon. Thank you all for being here, those of you in the room and those on our Zoom call. As a reminder, our statewide requirement for masks has gone into effect. This is the best tool at this moment that we have to fight this virus. The science shows that we are far less likely to transmit the disease when we are wearing one, and it is infinitely better than shutdowns. The combination of wearing a mask and staying 6 feet apart from your fellow Mississippian can go a long way towards helping us reduce the spread in our communities. Please continue to wear a mask as often as is possible. I know that over the last 4 weeks, more and more Mississippians have been taking the opportunity to wear a mask when in public. I believe strongly that if we will come together as a state over the next several weeks, commit to one another to wear a mask, it can not only help us as we get our kids back in school in a safe, responsible way, but it can also help us reduce the number of positive cases and ultimately, and we know this is a lagging indicator, but ultimately reduce our challenges on our healthcare system and ultimately reduce the number of fatalities. One of the things that I've tried to do over the last 6+ months as we've done these regular press conferences is to not only talk about the response from a public health perspective, but also talk about our response from an economic perspective. As you all know, I created a Restart Mississippi group months and months ago, brought together some of the greatest minds Mississippi has to offer in the world of business and industry. They came up with many great ideas. And today, I'm excited to announce, after the legislature made a very good, very wise, great decision to implement this idea, and I am forever thankful for them doing so. I am excited to announce a new program called Reskill Mississippi. This program will help individuals and employers across Mississippi who have been impacted by COVID-19. As I have discussed repeatedly, while we are in the midst of a public health crisis, we are also fighting this disease on an economic front. Hundreds of thousands of Mississippians have been laid off during this pandemic. Countless Mississippi employers are struggling to make ends meet. I believe that Reskill Mississippi may be able to help some of those who are hurting. In May, my Commission on Economic Recovery recommended that CARES Act funds be utilized for workforce training efforts to help displaced Mississippians. As a result, the State Workforce Investment Board, led by our chairman, Patrick Sullivan, made a recommendation to the Mississippi legislature for those efforts. Patrick is here today and will discuss the program in more detail shortly. I want to remind everyone, the funding for this program was passed by the legislature, which made the Mississippi Department of Employment Security the fiscal agent and our state's 4 local workforce areas the administrators. I give you all this background to say that this has truly been a collaborative effort. Reskill Mississippi is an effort to utilize these CARES Act funds to not only get Mississippians back to work, but to get them skills training that will help them work in even better jobs than they may have had before COVID-19. Long before COVID-19 hit our state and our country, I frequently discussed the long-term goal of raising household incomes in our state. I believe firmly that this program can make a real difference. Reskill Mississippi has 2 components, one that allows individuals to get short-term training at one of Mississippi's community colleges for skills that are in high demand, and another that incentivizes companies to train individuals on the job by reimbursing wages during the training period. The website that individuals and employers can revisit to learn more about this program is www.reskillms.com. www.reskillms.com. If you are an individual who is hurting economically because of COVID-19, this program just might be for you. If you are an employer looking to hire individuals and train them yourself for the specific skills that you need, this program just might be for you. I would ask all of you watching today to visit reskillms.com and fill out the appropriate form. At this time, I'm going to pass it off to Patrick so that he can fill you in on a few more of the details and the goals of Reskill Mississippi. Patrick, thank you for being here. The floor is yours.
Thank you, Governor. I'll be brief. I think the governor did a great job describing the program. Legislature certainly did a great job. It was great to work with in responding to the need with so many Mississippians having their jobs impacted by COVID. This is arguably the biggest economic need going forward. But as the governor said, this is a need that existed even prior to COVID. COVID just increased the importance of it and expanded the need of it as far as how many individuals out there are impacted. So the program, what you'll start to see across the state, and this is what we want people to know, you'll start to see that Reskill Mississippi brand. We encourage people to visit reskillms.com. If you have family members, if you have friends, young people, adults that are out of work looking for opportunities, or even in work looking for better opportunities. In my opinion, at this point, I don't know if there's anybody in Mississippi not impacted by COVID. So the point of this program is to help people. And for people to know about it and know about the opportunities, there must be a massive outreach effort. And that's what Reskill MS is about. There's a website that you can go to if you're an employer or if you're an individual looking for an opportunity that makes it very easy. You will provide a very basic amount of information, and there is a network of people across the state that will reach out to you. And the reason for that is if you are an individual in Tupelo, Mississippi that is interested in considering getting trained into an occupation where you have the opportunity to make more money than what you were making before all this started, then you have a specific set of opportunities at Itawamba Community College. If you're in Stone County, Mississippi, then there may be a slightly different set of opportunities available at Mississippi Gulf Coast Community College, or a different set of employers that may be looking and interested and able to hire in 2020 and train people on the job into good-paying occupations. And so the people that will be reaching out to you are people that are more local to you and know specifically in your area what the opportunities are. But the effort that the governor recommended, the effort that the legislature funded, was aimed at increasing training capacity across the state at our colleges, at the community colleges, to train in these critical high-demand areas where, one, people have a really good chance of getting a job, but not only a job, a good-paying job. And so the message today is go visit, or encourage people to go visit reskillms.com. If you don't hear from somebody, you should hear from somebody within a matter of a few days. If you do not, you can send an email after 7 days to reskillms@mdes.ms.gov. The money is appropriated to the Mississippi Department of Employment Security and making its way down into all the corners of Mississippi through 4 planning and development district offices, the 4 local workforce areas, and then down to the colleges from there and employers across the state.
Thank you, Patrick. I sincerely appreciate your effort. I spent much of 2019 talking about Mississippi's need to improve and build on our successes when it comes to workforce development and workforce training. Part of that effort, once I was elected, was choosing Patrick to lead our state workforce investment board. He worked very closely with the legislature, not only in revamping that board, but also getting this program put into place. And so I want to personally thank Lieutenant Governor Hoseman and Speaker Gunn. I want to personally thank Senator Parker, as well as Representative Donnie Bell, who have worked very tirelessly with us to get these programs in place. You should never start naming names because I know I'll miss someone, but certainly those 4 individuals were helpful to us as we revamped the board, as well as when we got this program put in place, and I'm proud of that collaborative effort. With that, I want to turn it over to Dr. Dobbs and let him tell us about our current caseload. Dr. Dobbs?
Thank you, Governor. Today we're reporting an increase in cases from the past few, 1,245 new cases, and sadly 51 additional deaths. That brings our total case burden up to 63,444 with 1,804 total deaths. If we look at our hospitalization numbers, we've had relative stability in our total hospitalized patients at 970, with ongoing increases in our ICU capacity, which is a real concern, at 329 ICU patients and 192 on mechanical ventilators. We anticipate that we'll have ongoing issues with critically ill patients as folks get sicker through the course of their illness, unfortunately. If we look at our school scenario, we do see that we are starting to have more and more reports of cases in schools as they've opened up. As we discussed yesterday, Corinth school system in Alcorn, they now have an additional case, and so they have 6 total students who've exposed additional folks within the school system and over 100 students quarantined. Additionally, we have cases reported from Tate County, Forest County, Tippah County, and Webster County as far as new cases are concerned within the school system. We are working with school systems to make sure that they know what they need to do and are depending upon the school systems to initiate those quarantines. We've had extensive trainings and guidelines, so please feel free to go on our website and look at those. That's one of the biggest challenges of starting school right now is the fact that because so many people have coronavirus in the community, that when they come into school, even if they're not spreading it and there aren't outbreaks, it's going to require a lot of children and teenagers to be quarantined after the exposure. We will be testing a lot of the kids in the Corinth area who were exposed. That'll give some good information on the effectiveness of the safety interventions that have been implemented at the school system. The one last thing I would like to mention is we are excited to be in Lexington over the next 3 days. On Thursday, we're going to do another testing event for all of the nursing home residents and employees. And then on Friday and Saturday, we're going to offer free testing to all residents of Lexington and the surrounding communities. You don't have to have symptoms. You don't have to have exposure. We want to test everyone. And again, there's no charge, and you don't have to sign up. We have 2 different locations, and you just show up, get in line, and we'll test you. This is a great opportunity to really do a good thing for Lexington, and we hopefully can use this as a model for different communities throughout the state so that we can do comprehensive testing with rapid turnaround, and then we can go ahead and get our case investigators and contact tracers actively involved in those areas so that we can be impactful and not get sort of caught in this sort of, tail chasing situation where we're waiting on labs from private corporations and stuff like that. So anyway, stay tuned. We'll give you guys more information. And please, if you live in Lexington, we really would like to offer you the opportunity to get tested on Friday and Saturday in your hometown. The last thing is a little Mythbuster segment. A friend of mine emailed me a picture of a letter from CDC that said that they recommended not wearing masks, and I was very interested to see it. I was quite amused at the frequent use of all caps for emphasis and different fonts. The choice of language was a little bit atypical for CDC, and fortunately we have a CDC team with us over at the Department of Health, and we all had a good chuckle. Social media is a great way to share information with your friends, but it's not an accurate source for news many times. And so obviously that was not a real letter from CDC. So anyway, thank you, Governor. Appreciate everything.
Thank you, Dr. Dobbs. Again, I want to reiterate that if you are watching us today and you have a friend, or if you live in Lexington, or if you have a family member that lives in Lexington, we strongly encourage you to get tested over the next 3 days. This is an opportunity for us to work with our friends at the CDC. We're going to gain a lot of knowledge, gather a lot of data, from this particular exercise, and we think it's going to help us make decisions in the future, because we are definitely data-driven, and it's something that's important. And so I am hopeful that if you are in that area of our state, that over the next 3 days you show up and you get tested, and we can hopefully confirm that you are negative. If that is not the case, then we can work to make sure that you're isolated and you get the necessary treatment and help that you need. And that's what our entire response is about at this point, is recognizing that we have challenges and we have community spread in every community throughout our state, and we're doing everything we can to make sure that we protect our fellow Mississippians. And so to that end, what I'm going to do now is I'm going to turn it over to Mac, who's going to give us an update from the emergency management perspective. And once Mac gets done, I'm actually going to bring Patrick back up to the table. So I know many of you will have questions about our Restart Mississippi and Reskill Mississippi plan, which Patrick is most able to answer, because it's been something that he's worked on tirelessly for a number of months. And so with that, Mac, talk to us about the Emergency Management Agency.
Great. All right. Thank you, Governor. Just want to give an update on the Corona-19 Emergency Relief Program that we've been running for municipalities and counties since Monday. We fielded about 97 more calls in about the last 8-hour period. That puts us well over 250 entities that have been calling our helpline to discuss things. And our regular FEMA reimbursement program, we're up to 426 applicants in that program for the municipalities and counties, and also just going straight through with the CARES Act funds that are allocated for them as well. We're up to 87, so that pushes us a good number for just 3 days short work, and we've already started making payments out to some of those counties and municipalities. So that's actually a great win, sir, going on there. If the public wants to look at any of our PPE that we're buying and that we're able to give out to the municipalities and the counties and whatnot, that of course is on our website. You can go and look there for the transparency of our program. And I always like to bring a fun fact at the end. And since March about 15th, MEMA, along with the Department of Health and our 6 separate warehouses for PPE that we are currently managing in 2 counties, we have ordered and moved over 70 million pieces of PPE. That's significant. And over 217,000 miles traveled by soldiers and others that have been delivering to those counties, to the long-term care facilities, et cetera. We've also been coordinating with the Department of Health to purchase, rent, and lease reefer trucks and whatnot in case any of the COVID-19 bodies have take over any county expectation or their ability to manage. So we're on a conference call with FEMA as well as the county emergency management directors, and as of today, we currently don't have that need, but we're working with the medical examiner's office as well. So, sir, that's the snapshot. We do have one little storm out in the tropics, but it seems to be going away, so we're looking good for the next 7 days.
Well, I talked to several people along the East Coast over the last 36 hours, and I know they've been getting hit pretty hard, and we certainly want to pray for them. We know what it's like to be dealing with COVID and natural disasters. We dealt with tornadoes. We dealt with tropical storms so far this year during COVID, and our friends in red and blue states alike up and down the East Coast have had some real challenges in the last 36 to 48 hours, and I want to personally let them know that we are praying for them, and should they need assistance, just like they stepped up for us, we will step up for them. All they have to do is ask. Yes, I've let numerous governors across the East Coast know that, and I will continue to do so, because that's what we do. That's what we as Mississippians do. And we have friends that are in need, we step up and we help, and we certainly know from an emergency management perspective how to do that better than most. I do just want to reiterate something that Mac said, because I think it's important. You know, there's a lot of people who have made sacrifices with respect to COVID-19, and it's been difficult and it's been challenging. But when you think about those members, those men and women, the Mississippi National Guard, those team members at the Mississippi Emergency Management Agency and the State Department of Health, it is no small deal that they have delivered 70 million pieces of PPE throughout the last several months. 70 million pieces. We're in a state of 3 million. So that's literally almost 25 million per, just 2.5 times those numbers. And so that's just absolutely incredible what they have done. And I want to personally thank every single one of them. That's the good news. The not so good news is it's not over. And the fact that it's not over means that we're going to deliver, I hope not 70 million more over the next 5 months, but if we have to, that's what we will do. We stand ready to do everything in our power to protect those throughout this state. But we can't protect everyone in this state just by sitting at this table. We need your help. We need the help of our fellow Mississippians. We need everyone to participate in our plans. We need all of our restaurant and bar owners to participate by ensuring that we enforce the orders that are in place. And we need a statewide effort over the next couple of weeks that everyone wears a mask. I've said repeatedly that I am very comforted, and I feel so much better that we have so many people that are doing that. And we also, and we know that we are improving on that. But now with the statewide mask mandate, if we can come together for the next 2 weeks, we can continue to slow the spread, and it'll make a huge difference down line, not only in terms of helping us safely get our kids back in school, but also helping us do things that we want to do, like football and other college and or high school sports. But we've got to make sure that we make this sacrifice over the next couple of weeks to make sure that we continue to slam the door and try to slow the spread of this virus. So with that, I want to thank everyone for being here. Patrick's back up, and so I'll open the floor to questions. Yes, ma'am.
Governor, just before the press conference here, you had a thread of tweets about a lawsuit filed by the speaker. Has that lawsuit already been filed, or have there just been discussions of it? And can you tell us your thoughts on that?
Sure, and I appreciate the question, and I can't go into great detail because I haven't seen the litigation yet, but I have been told that there are a few leaders in the House that plan to file a lawsuit questioning the governor's ability to line item veto a couple of bills and a couple of items. My understanding is that deals with the education budget, so let me address that first. I find it exceptionally odd that the leader of the House Education Committee has said that it was a mistake leaving out the school recognition program and that they could have easily fixed that, but then yet they're going to sue to say I don't have the authority to actually line item veto it. I find that exceptionally odd, and so I'm interested to see what their logic is there. The other thing is, if you'll recall, in the budget that spent CARES Act money through the State Department of Health, there was several individual projects that, quite frankly, were earmarks. One of which was an earmark for a hospital in Tate County. It's a hospital that hadn't been open in 2 years. Not only have they not treated any COVID patients, they hadn't treated any patients during the life of this pandemic, but yet there's a connected legislator who wants to throw in $2 million for his hospital to try to get a deal done. I don't think that makes sense. I don't think the taxpayers of Mississippi ought to be participating in that. And then the other line item veto that I'm told that they're going to sue me over is the one that provided $6 million for a hand-selected few FQHCs to do a disparity study. As I said in my veto message, if they had given that money to the State Department of Health and we had a real logistical plan to spend those resources on that purpose, we certainly would have considered it. But it just seemed really odd to me, some of the interrelationships that had occurred between this hand-selected few of FQHCs, that then all the other FQHCs, all of whom were struggling mightily with COVID, would have to ask them for a piece of the pie. It just didn't make sense. And so my understanding is that they're going to sue me, and we'll see exactly what the specifics are at that time. Jeff?
Governor, I believe some of the legislative leadership's already been talking too about potentially reconvening themselves. What are your thoughts on their ability to do that? And also, is there any update on your time frame when you might call them back into special session?
Yeah, we actually had a conversation about that earlier today. I think if you look and you actually read the order that passed the House and the Senate, it's very clear that they can bring themselves back for any COVID-related issues that are at least 6 days. They have 6 days between now and the end of October. That is what the leadership told the members when they voted for it, and I can't imagine that the leadership would not tell the members the truth. And so they certainly can come back for COVID-related expenses for 6 days between now and the end of October. We certainly want to bring them back in a special session. In fact, we have to bring them back in a special session. And the reason for that is they did not pass a budget for DMR. And then obviously this lawsuit complicates things a little bit because we want to bring them back so that they can do the K through 12 education budget. And we've just got to figure out exactly what this lawsuit says as they choose to sue us rather than work this out, which I don't think it's a very wise decision. And quite frankly, Jeff, I'll tell you, there are an awful lot of Republican legislators who do not believe this is a good idea. They do not believe this lawsuit is a good idea. They have made us aware of that. I believe they've made the House leadership aware of that. And so the reality is that we've dealt with everything in 2020, from tornadoes to prison crisis to state agency heads from the previous administration going to being indicted, to the third largest tornado in in American history, the largest in Mississippi history. We have dealt with just about everything you can imagine. And so dealing with yet another power grab by some members of the House is just not all that surprising to me, although I never would have guessed it a year or so ago. But it is what it is, and we'll deal with it appropriately. I will tell you this, Jeff. We need to get both of these issues, the Department of Marine Resources and the education budget, resolved as quickly as possible. But I'll also tell you, I've been told as recently as this morning of an additional member of the legislature that has tested positive for COVID-19. Someone who has tested positive recently, very recently. And so I am not willing to play political games at the expense of the public health and safety of the men and women who go into that building across the street. A lot of them are friends of mine. A lot of them are really good people. And if there is the potential of more of them actually having COVID-19, we saw what happens when one person walks into that building, as occurred in late June with the virus. It can spread very, very, very quickly. I don't know what the updated numbers that Dr. Dobbs may have, but my recollection, the latest I heard, is as many as 50 people, either members or staff of the legislature, got the virus from that building. If in fact it's true that we are seeing additional members that have tested positive, I don't think that it makes sense at this time to bring them back. Now again, that is it is speculation that has occurred, but I believe it's I believe it. And so, as I've said, I want to bring them back as soon as it is humanly possible to do so, when it is safe. And if it is not safe, I am not willing to put any of them, the many, 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 many of them that are friends of mine, and those of them who just want to fight just to fight. I don't think we ought to put any of them back in there, in that fishbowl, because we saw when one person has it, it can go to 30 or 40 or 50 very, very quickly. And that's not something that, given where we are today, makes a lot of sense. Joe.
Governor, why is it not safe to send them back to the Capitol, but it's okay to send hundreds of teachers, students back to school?
Well, as I just said, that we have what we believe to be at least additional confirmed positives within that particular subset of individuals. We have seen what it does and what it means when there are those in the building that are positive. When you think about what has transpired over the last several weeks with respect to our school reopenings, we have reviewed somewhere in the neighborhood of 600 pages of reopening plans. We believe that a large number of them, not all, a large number of them certainly have good plans in place. We also know that when you're looking at kids, for instance, in the pre-kindergarten through 6th grade area, that the likelihood of transmission is certainly less. And then when you look at those in our entire state, just looking at our specific data, the fact is that this virus is certainly not as harmful, certainly from a fatality standpoint, for those under the age of, say, 70. And so we think that there's also tremendous risk if you are a school-aged kid, as was confirmed by Dr. Redfield at the CDC. There are risks to opening schools. We know that. I don't want anyone to think that there is not risk for kids to going back to school. But for some, it seems that you're willing to recognize and admit that there is risk to kids going back in school, but completely ignore the risks that are associated with kids not going back to school. And the fact of the matter is that I, as the decision maker, I guess, although the reality is that we live in a state in which we have decided to give great autonomy to our local school boards and our local superintendents. They certainly know their populations much better than anyone in Jackson does. And we trust them with the education of our kids every single day and every single month and every single year. We've got to hope that that the plans that they have provided us, that they are actually adhering to them. In those counties where we thought transmission was at a rate that was so high that it wasn't safe to put those 7th through 12th graders back in school, we shut down the buildings. Said you couldn't open, and that's what we did. We didn't do it for all kids because we don't think we should treat every community exactly the same. But in Hinds County, we certainly said that this is a county that has far more than 200 cases in absolute terms for the last 2 weeks, and a county that has had far more than 500 per 100,000 residents. By the way, that's saying something in Hinds County, right? Because when you look at that particular threshold, I'll give you an example. We didn't put Issaquena on the list of the mask mandate one day last week because they reached that 500 per 100,000 threshold, but they only had 7 cases at the time. It's just such a small population county that they didn't have very many cases at all. Whereas in Hinds County, because it is a large population county, the fact that they have reached both of those thresholds is certainly very concerning. We know that there are additional measures in place here. There are not only additional measures that we have put in place, there are additional measures that the local authorities have put in place, and we hope very much so that we can get the spread under control in all of our communities throughout the state. We are seeing, and I want to be perfectly honest, as I've been and completely transparent with the people for many months now, we are seeing positive signs. But just like I said yesterday and just like I said the day before, we still have a long way to go to get this under control. And we know that hospitalizations, and particularly, as Dr. Dobbs has said repeatedly, ICU numbers, et cetera, tend to be lagging indicators because oftentimes it takes days, if not weeks, for someone who contracts the virus to then go into that ICU bed in a local hospital. And therefore, we still have hospital capacity issues that we've got to manage through and work through, and we know that. But in terms of total number of new cases, we are seeing positive movement. We certainly are seeing days that, when you look week over week, are significantly lower than they were last week. But again, a lot of that, again, as I said last week when they were really high, I'm going to say it again this week when they're significantly less high, A lot of that is testing. It is test results. We monitor date of onset of illness, and we still have a upward trend on date of onset of illness. Again, that was from 14 days ago primarily, but we've got more work to do. And so I don't want to lead anyone to the conclusion that all is good, because it's not. But we are seeing positive signs. And if everyone will participate, if everyone watching today will choose to participate and tell 5 or 10 of their friends, either on social media or otherwise, or just pick up the old phone and call 5 of your friends and say, hey, I'm going to wear a mask because I care about my kids. Or I'm going to wear a mask because I care about my grandkids. Or I'm going to wear a mask because I care about my mom or because I care about my grandmom, then I think that'll make a huge difference. You probably have noticed us on social media. We have done a whole campaign about Mask Up Mississippi, hashtag Mask Up Mississippi. And we started that with a tweet from myself and one from my wife, where we tagged 5 people. And while I don't understand these terms like viral and other things, I think we certainly have reached a whole lot of people. And what I challenge all of you in the media and everywhere else, don't be afraid to, you don't have to retweet me, but pick somebody you like and retweet them and say that you like, you wear a mask for your son or your daughter or whomever you wear a mask for, so that we can get that message out, that it is okay to be a strong person and still know that it is important that we all wear a mask. And for the next 2 weeks, while we're under this statewide mask mandate, and I will extend it if I find it to be necessary to do so, by the way. I just want to be clear so everybody knows, but I want to start with a 2-week time period. If we will all just participate in the next 2 weeks, I think it can help us. Certainly we're seeing not only improving data here, although we're a week or 2 behind, we're also seeing improving data in Texas and in Florida, in some of the other southern states that certainly saw a wave in July and early August. I did personally speak with Dr. Burks this morning, had a very good conversation. She obviously is running the coronavirus task force for the president. She certainly saw that we did the mask mandate yesterday, and we talked a little bit about restaurants and bars. She now is familiar with the restrictions that we have in place, and they're good restrictions. And so we're going to continue to monitor the situation, but I think if all Mississippians will step up, we have a really good chance of making a difference in the coming days and weeks.
I have a follow-up for my original question, if you don't mind. Sure. About schools and why is it safe? Why is it safe to send teachers back to school? Is it that not the same case as if you send legislators back and they have underlying issues? Some may be on the older end of it. One school district just announced that a teacher tested positive. Why is it okay to send teachers back to the classroom?
Well, as you probably heard me say yesterday, Gerald, about 90% of Mississippians have been in and out of work for the entirety of this. Some of them certainly didn't work during the shelter in place, which lasted about 2 weeks in Mississippi. And so there's no doubt that in our public schools there are going to be risk associated with opening schools. We know that. We also know that there's risk sitting in this room right now. There's also risk for kids not going back to school. And so what we've got to do as leaders, in my opinion, is we've got to figure out a way to manage and mitigate as many risks as possible. And I believe that the plan that we have in place puts us in a position whereby we are best managing that risk and best mitigating that risk, not only for our teachers but for our students and, quite frankly, for the population at large. As I said yesterday, if I were running a school district, I would personally not open that school district until August the 17th, maybe even August the 24th, depending on what the numbers look like in my counties. And that's just a blanket statement. If I were running a school district, I would not open until August the 17th at the earliest, and probably August the 24th. But I didn't get elected to run a school district. We've got literally hundreds of Mississippians that got elected to school boards to run their school districts. We in Mississippi believe in autonomy. We believe in giving them the opportunity. And there's a reason for that. And most of the times they get it right. And I'm really hopeful and certainly willing to provide information or guidance to anyone who asks questions that needs additional guidance. And we're doing everything we can and having conversations about what additional resources we can provide as well.
Thank you, Renee. Question for the governor, and then if possible, I have a follow-up for Dr. Dobbs. Governor, there's been some confusion down here among parents and state officials with your statewide mask mandate for schools. All Mississippians must wear masks when inside a school building, a classroom, or outside on a school campus. And here's the caveat: when social distancing is not possible, what would scenarios be where outside mask wearing would be optional relative to social distancing?
Well, Dave, thanks for the question. What I would say is wear a mask. If your kid is dropped off at school or gets on a school bus, wear a mask. Wear a mask in between the bus and the school building. Wear a mask while you're in the school building. What we have provided is a minimum standard, but we believe that everyone needs to wear a mask. Now, there are a lot of kids in Mississippi, for instance, who walk to school, and if you are an individual kid that is walking home from school by yourself and there's no one within 30 feet of you, you don't have to wear a mask. That's not necessary, and the reason it's not necessary is because there's not a lot of risk to transmission if you're not within 30 feet of somebody. But again, when you're writing executive orders, you've got to, at a minimum, provide a minimum standard by which people can go by. But people just got to use common sense. And generally speaking, and what I have found myself doing more and more is if you are in public or if you're in a confined space and you're near other people, please wear a mask.
Dr. Dobbs, the Department of Health has asked people to report businesses who are not complying with state orders, and let's face it, it's mostly bars and restaurants. About 330 complaints have been reported statewide, mostly not wearing or incorrectly wearing masks, no social distancing, or exceeding allowed capacity. Could you take us through the follow-up process the Department of Health follows with these businesses?
Sure. The businesses that we regulate, right? That's really mostly what we're talking about right here, the restaurants. We'll send them a notification outlining the complaint and giving them a reference to the different executive orders and guidance. Sometimes they just don't know exactly what the rules are, and so it's helpful for them to know exactly what the rules are. We have the intention, that 330 is a lot, so. But then we plan to go and visit and have a conversation and talk over their compliance plan and make sure that they have a pathway of providing a safe experience for their customers. And then if there's something more severe, we'll talk about more extreme actions as far as even restricting their ability to operate. This is a safety issue. It's just like having salmonella in the kitchen sink. There's a safety guidance. They need to follow safety guidance, and by and large, they are, and when they're not, by and large, they have complied when they were shown the best way to do it.
Hunter Dawkins with Gazebo Gazette has a question.
Thank you, Renee. Thank you, Governor. Governor, this is a question for either you or Mr. Sullivan. I know the object of you promoting the workforce training initiative. And you have spoken about the fact that the plan is to work with community colleges. My question is there any promotion of the state to work from a VOTEC level with local labor unions and apprenticeships or organizations and internships?
Generally speaking, the answer is yes. I sincerely appreciate that question. I think all of those are critically important. Apprenticeships is becoming kind of the go-to phrase these days. And when you look at our workforce training efforts and you look at our economic development efforts, you will see us continue to expand that and grow upon that as being a very important piece of the overall equation. But I'm going to turn it over to Patrick and let him talk a lot about that because he's worked a lot on it.
Yeah, what you're talking about are things that are needed. With the context of Reskill Mississippi and the dollars that the legislature appropriated, the total is $55 million. $49 million of that goes to community colleges for them to do capacity upgrades. So in all these critical training programs out there that train people into a higher level skill that gives them the chance to get into an occupation to make more money, the pitch that we made to the legislature is, in Mississippi, and especially in the context of COVID with where we are today, we need to push more people into these opportunities, at least let people know that these opportunities exist. Then they can make up their own mind. And then after that, we've got to have a spot for them at the community college. So the colleges do a good job, by and large, training in some of these areas, but the capacity is limited. And so the money that was appropriated will give them the opportunity in a lot of cases to go in and buy equipment and create space to train in some of these critical areas. The confines of the CARES Act limited the state and the legislature in what they were able to do. And so it wasn't quite as flexible as we would allow. There's a very strict time requirement to this. Of course, everything that we do has to be directly tied to impacts from COVID and to the public health emergency. But there are a comprehensive set of things that we need to be looking at as a state going forward, including the expansion of apprenticeships, et cetera. The bottom line here is that with Reskill Mississippi is the goal is to help Mississippians who are interested in considering new opportunities to get connected to these opportunities. And so those are in two places in this program. One, they're in training programs at the community colleges, and there's 15 colleges around the state. So wherever you are in Mississippi, there's a college and a training center close to you. And then two, as the governor said, there's a number of employers out there who are looking to hire people and train them on the job to operate a piece of equipment or something that requires a certain level of skill. And those employers aren't looking for people coming out of any particular education program. They're just willing to hire and train directly on the job. So there's a benefit that was provided in the appropriation to provide employers who are willing and able to do that in 2020 a wage reimbursement to cover a big cost of the wages for that employee just during the training period, during the period when they're bringing that employer on and training them to do the job, which is typically a 4 or 8 week period.
And again, a big kudos to those leaders in the workforce development, workforce training area in the legislature for recognizing the importance of this. Look, we know what the jobs of the next 5 years, next 10 years are going to be when it comes to those higher wage, higher skill jobs. And so if we can target our investments such that we are training more people in those specific jobs, we can grow per capita income in Mississippi. And it's the reason I ran for governor. I look forward to being able to spend 150% of my time working on it. As I told you yesterday, I'm only spending 90% of my time working on it because the other 90% I'm spending working on COVID-related stuff. But Patrick and his team are doing a great job, and we're continuing to build our team and build our efforts around that. So.
Jackie with WHBT has a question.
All right, so Corinth School District has about 8 cases of COVID-19 right now, and several people are isolated at home. So if the spread gets out of hand and bad enough, would the school district have to shut down the schools, or would the state step in and decide? Like, could you explain how this process would work? Is there a plan in place in case the spread gets too out of control and schools are starting back?
Yeah, so that's a great question. We do have a guideline for schools to use as a trigger. If there have 3 or more kids within a certain classroom or a certain group, then all of them need to just be quarantined. If we have 3 or more simultaneous groups of that nature, then that's a time to consider letting the school have a 2-week break. Right now it's kind of interesting because we're so early in it. It's really just kids bringing it in. There's really no chance that they caught it there. So we're kind of at a different sort of inflection point. But we would have those conversations with them, and would certainly want to have a sort of joint conversation about the best timing for that if a school did need to take a break. But if there were a break taken, a couple of weeks makes the most sense to let the disease sort of flesh out as much as it can. But these aren't kids who caught it there. The main thing is to prevent transmission within the school. And as we mentioned earlier, it's really tough to run a school when you have so many kids quarantined. The other thing I do want to say about the mask, though, and I meant to say this earlier, I apologize for tagging this on, is it is my understanding that in private schools that masks are needed as well. So this is not just a public school thing. Private schools are going to have the same issues. Obviously, they're human beings too, and need to wear masks also.
Which I will tell you is at least part of the reason, not all of it, but at least part of the reason we did the statewide mask mandate is to coincide with the mask mandate that we did in all schools, because now there's a mask mandate inside all buildings and schools, et cetera. Let's just talk a little bit about what's going on in Corinth. As you all know, I know Dr. Childress very well. Those who are skeptics and those who believe we should not ever reopen schools would probably look at Corinth and say, oh my gosh, we told you so. I choose to look at Corinth and say, while it's unfortunate, obviously, that any kid has COVID-19, the way in which they are responding, recognizing that there are positive cases, identifying those people that they have come in close contact with, quarantining them, in many instances testing them, is the way in which to respond. And the fact is that while we do have a large number of kids that are in quarantine in Corinth, we also have a whole bunch of kids that are in classrooms that are learning. That seems to be completely lost on some. There are a whole bunch of kids in Corinth that are in classrooms today that are learning. There are a whole bunch of kids, maybe in other places, that maybe wouldn't have had a healthy lunch had they not gone to school today. And so, again, I want to reiterate that there are a lot of risks out there that we're trying to mitigate. I do think we're going to learn a lot from what's going on in Corinth. It's going to help us, but we're going to have more cases in more schools. We are going to have more conversations about the potential of are we at a point where we need to provide a break for that particular school district. As Dr. Dobbs has said, we're going to have conversations with the local school board members and local superintendents if it ever gets to that point. And my guess is those conversations are going to be very fruitful, and if the recommendation of the state is that they need to shut down for a week or 2 weeks or whatever the number is, that they're highly likely going to agree to that. But if they do not, if it gets to a point where it is necessary, I will be prepared, just as I did in the counties that I said yesterday. I will be prepared to step in and make that call if it becomes necessary. You know what? What I've found is that in some areas, and not all, but in some, no one wants to be the bad guy. No one wants to have to stand up and say, we've got to shut down. I have shown a willingness over the last 7 or 8 months, and quite frankly, over my entire career in politics, 17 years, I'm going to do what I believe is the right thing to do for the people of this state. And if that means it's unpopular, and that doesn't, then I'm going to do it. Whether it's unpopular or not, I'm going to step up and do what I believe is right. Now, that is true if it comes to vetoing a pet project stuck in a bill by an individual legislator. It also is true if it means shutting down an individual school or school district because of too much transmission and a risk level that makes it necessary to do so.
Jimmy Gates with Clearing Ledger has a question.
Yes, Governor, how are you today?
I'm doing good, Jimmy. I'm good to hear your voice. I haven't seen you in a long time.
Yeah. Hey, Governor, it has been reported that only 1% of the $240 million in grants set aside for businesses impacted by COVID-19 has been dispersed. And I was just trying to see, is that a concern of yours that such a small amount has been dispersed as of yet?
Well, as I've said repeatedly about question after question while sitting at this chair, if you are asking a question that begins with the words, is it a concern, it is highly likely that the answer is going to be yes. I am certainly concerned with all of the various CARES Act funds. Many of what we have many of the concerns that I had early on with respect to how long it would take to get money to individuals if the legislature were responsible for appropriating these dollars, as they insisted, have come true. I'm concerned about it, but I'm not at all surprised about it. It took several months for them to pass legislation on lots of these programs, and then it's taking several days, weeks, and sometimes months to get the mechanism in place to then go out and actually distribute these funds. With respect to the Back to Business program, one of the things that we are finding, and I'm actually getting some specific updates on this later today, but one of the things that we're finding is there were an awful lot of businesses that should have been eligible for some part of this particular program, but these businesses hadn't filed a tax return in the last 2 or 3 years. And so that certainly raised the interest of many legislators and those in the executive branch. We also know that the Department of Revenue had a piece of that Back to Business program, and they sent money out to a lot of folks as defined in the state statute, and they found that a lot of the ones that they sent money out to had not filed a tax return in the last several years. And so they're now in the process of trying to recoup that money, because it turns out that those businesses were not eligible based upon the state statute. And so we are working with the Mississippi Development Authority to get all of these kinks worked out. But I also think that it is likely that the total amount that was allocated for that program was probably significantly overshot the actual businesses that are going to be eligible.
Yes, I have a question for Dr. Dobbs. This weekend, a private business is scheduled to host a flea market indoors. It's inside of a rather large facility, and the business owner is saying that he's going to check temperature, and that and that they're going to try to enforce social distancing as best they can. And they also held this event last month. But I was just curious, just from your perspective, from a public health perspective, if you think that it's wise to host an event like this, and if you think that these measures can sort of offset the risk involved with having an event like this in Tupelo.
First of all, people who live in the Tupelo area probably would recommend you just not going, for number one. I mean, it's just the wrong time of the pandemic for folks to be getting in any big group. So, and especially older folks because within any group of 100 people, there are going to be 1 or 2 people who have coronavirus. It's just inevitable. So if you have 1,000 people at an event, there's going to be, 10, 20 coronavirus patients. So there will be transmission if you're not careful. As far as like the legality of it, there are some parameters in which that should be permissible on the current executive orders. But even so, any group gathering like that is going to be a dicey proposition, especially indoors, even as sort of a business environment. So the temperature checks and stuff is a useful but minimally impactful endeavor. It'll help catch a few people, but we know most people are spreading it are either going to be asymptomatic or minimally symptomatic and are going to feel perfectly fine to go out and spread coronavirus. So, please don't go. I would ask businesses to be as responsible as possible as we look at different. I know the governor obviously is in charge of those rules, but there's some common sense too that people can use. So just stay out of crowds, for crying out loud. It's just the wrong time.
Isabel Taft with Sun Health with a question.
Hi, I have a question regarding school reopenings. Corinth has been described as a model for the state today and yesterday, and one of the things that they've done is posted information on their website each time they have a positive case. And so my question is, are school districts going to be required to notify the general public, as Corinth has done, whenever they have a positive case in the school community?
Well, thank you for that question. I commend Corinth and their leadership for doing that. They're not trying to hide anything. They're being very transparent. They're working with the Department of Health. They're identifying the cases. They are choosing to isolate those who have come in contact with those who have it. So again, I don't know that there is a specific guideline in place that I'm aware of, but Dr. Dobbs may be that requires them to do it. But it certainly, I think, speaks very highly of Corinth that they're doing it, and I think all school districts should.
And we've been working closely and with them and are putting together a mechanism for some, de-identified reporting, some, over week periods, and we will plan to post that on our website at some point in the near future, where folks can see kind of what's going on county by county, as is in regard to the school system, similar to the nursing home stuff.
Hunter with Gazebo Gazette has another question.
Yes, Renee, thank you, Governor. This question is actually for Dr. Dobbs. This is some potential future, I wouldn't necessarily say a hypothetical, but there is just a question in this. Dr. Dobbs, there has been, I know you're having to spend, and the health department is having to spend lots of time and money on the testing and the results. Based on the studies recently that I've done some research on, National Institute of Health has done quite a bit of studies, or at least clinical trials on natural products and their cures, or even possibly getting close to stopping the advancement of coronavirus. And one of the recent clinical trials that was just finished in June said, low doses of some nasal spray and some different portions of natural honey could, in effect, eventually stop the spread of the coronavirus. Now, this is not in every single person, but this is in some. And for my question to you, Dr. Dobbs, would this be somewhat of a promotion that the Department of Health would try to help with certain communities?
I would have to look at each individual study to make a recommendation. I'll say just in general, if it sounds too good to be true, it probably is too good to be true. Local honey is good for your allergies. It's not good for coronavirus, most likely. So, if there's science behind it, we'll promote it. I'll be happy to look at those things, but they certainly haven't made it into their way into mainstream scientific journals as it pertains to coronavirus. So, we can always be hopeful for an easy answer, but we hadn't found one yet.
And I'm not going to prescribe any medicines or any home remedies for the coronavirus. Jeff.
Governor, kind of to follow back up on Gerald's question earlier, just trying to understand, okay, if it's okay, it's safe to open entire school districts with thousands of adults and children. It's okay for bars to be open under certain circumstances. Is it not possible for the legislature to meet safely? What is it about that group or that building? Or
It is certainly possible for them to take necessary precautions that make it safe. But we've also seen in real time what can happen during a legislative session. I've spent at least 8 full years of my life dealing with it, and I know what it's like. And we saw, obviously in June, that there were 50 cases-ish, and I don't know the exact number, but approximately 50 cases. We also know that there is at least a few potential confirmed cases of the legislature right now. And so when we decide, from my perspective, when I decide that it is safe for them to be reconvened, then I will certainly do so. Nobody wants DMR and the Department of Education budget corrected nearly as bad as I do. But as I continue to hear about the potential of cases, and look, there were legislators that have literally been in the hospital for weeks and weeks and weeks on end, some of whom may still be in the hospital from that outbreak in late June. And so is there, there are risks to anything, I understand that, but we certainly want to make sure that if we bring them back, or when we bring them back for the purposes of dealing with these items that did not get done during the first 6 months of this year, then we will certainly want to make sure we do it in a safe way. Yes, ma'am.
Governor, you were talking about CARES Act money. I believe, correct me if I'm wrong, is it $34 million that was the emergency relief for the schools, or the education emergency relief? Has that been divvied up, and if so, what types of things is that going to?
Yeah, so there was about $300 million that went to the State Department of Education. It went directly to the State Department of Education, which they then distributed out to the school districts. And so, you know, those who, and that was strictly for COVID-related expenses. That's for them to buy PPE and things such as that. It went directly to the school districts. In addition to that, the legislature, a program that I've been talking about for a long time, and we worked closely with them to get it done. They also, we wouldn't have done it exactly the way they did, but generally speaking, they had distance learning. They spent several $100 million more, so there's been about $550 million total that have gone to our school districts regarding COVID over the last 5 or 6 months. In that initial CARES Act bill, there was about $35 million that went, that we had to get approval from the U.S. Department of Education. We have submitted our application. They are, I haven't been told in the last week or two if that's gotten back to us yet. But if it is, we'll start looking at that additional $34 million in the coming days and weeks.
Anita Lee with the Sun Herald has a question.
Thank you. I have two questions. The first one's for Governor Reeves. Governor, I emailed the health department to ask for the on the criteria for school reopenings for the window that was used for the 14 days, the exact dates, and also for whether they were looking at just new tests, because we're finding here that Jackson County meets both criteria for delayed school start. I went from July 20th to August 2nd and found they had 814 cases in that time, and almost 567 cases per 100,000 people. I didn't find Harrison County met the second threshold, although we did have 642 new cases during that time frame. So I'm wondering why neither of those counties was included in the late school starts, particularly Jackson County, and I was told that you were the one who made the decision on which schools would start late. So my question is, why aren't either our counties on here, and also are there other counties that meet both criteria that didn't make the list?
Right. Well, thank you, and I'll have to get you the data that I used, and so we'll get that information to you. We've been looking at these school reopening plans over the last 5 or 6 days, and I just don't recall exactly what the exact dates that we were looking at. I will tell you that we looked at more recent data than, whereas when we were looking at the mask mandates from a county-to-county basis, we basically made the decision for it to be based upon a time period that had a bit of a lag, and there was a reason for that. But I'll get you the exact dates on that, and I just don't have it in front of me. I'm sorry. You have another question?
Anita?
I'm sorry, I didn't understand. I didn't hear the answer there as to why Jackson County didn't make the list, and they appeared to meet the criteria, and whether all counties that met this criteria were on the list.
Okay, if you just go ahead and ask your second question to Dr. Dobbs, and then I'll answer again your first question, just so we make sure we don't lose you.
Okay, and the question to Dr. Dobbs was, since we're not quite sure on we've gotten an update on the legislators, can we get a new update on how many legislators and how many staff have tested positive? Yeah,
so again, I'll repeat my answer to your question. which is basically, I will get you the exact dates that we used. They did not meet the criteria on the dates that we used, and that's the reason they were not included. But we're continuing to monitor that, and we're going to continue to look at the data as it comes in, and the delay in start dates, as I said yesterday, was the beginning of the conversation. It was not the end, but I'll get you that information. That's the question.
And Anita, sorry, but I don't have those numbers right in front of me, but it is several over 50 that we're aware of altogether. So we do have a team that's looking at that a little bit more closely. We do have a bad habit of getting distracted by other urgencies. So we'll continue to look at it. Thank you.
Thank you for your question, Anita, and thank you to all of you for your questions. Thanks for being here. Mississippi, stay safe out there, and God bless.